Good afternoon. This has been a long session, and I would like first to thank you for this invitation, of course. I would also like to thank you for this interesting title, Standards Convergence in Europe. And since there are not so many people in the audience, how many of you, just as a startup, think that there is such a thing as standards convergence? This is feasible? Okay, how many of you think that standards convergence is not possible? All right. All right. Okay. So we are not really sure in the audience, or we are not really engaged with the question of standards convergence. And I guess I like history, and in many occasions in my life, I look for the past to seek guidance and understand questions that have the potential of large impact today. So when I was given this question, I was perplexed, frankly. And I was perplexed because I didn't actually see a lot of point in standard convergence. And when I thought about things like the different formats that we have in VCRs or the different formats that we have in DVDs, I see that there is something new coming up every now and then, maybe a new technology, a new format, but the old ones become obsolete. So is this actually a sense of convergence, you think? The fact that technology advances and we bring the new, the best, the better into a new format? Or is it a war that the fittest survives? I think that, as George just voiced, it's a little bit of a mix of both. It's who has the better marketing, it's who has the better solution sometimes, but it's also a question of what we need. So with that, I will go back to our little problem that my speakers before me actually had a very good setting the stage. So we heard something about a European medicines database. That's how I interpret what Carl mentioned. So imagine that we knew about all the medicines that have an authorization to be sold in Europe or be prescribed in Europe. My vision is that we cross the cross-border. We put an X there, and we talk about Europe. And I imagine a future where you could say, I want a prescription that works throughout Europe. This is what brings value. This is what brings economies of scale in a Europe of 500 million people. That's the single market for me. That's standards. That's what convergence is. And frankly, in that context, I don't really care about convergence. I just want the thing to happen. I just want the unique single medicine database in Europe. Think about the power in clinical trials. We heard Zoe talk about ERNs, rare diseases. I mean, the problem with rare diseases is the numbers. Can you think of a rare disease management in Greece of 10 million versus rare disease management in Europe of 500 million people? The power is immense. But still, we have the national governments that think, you know, we have our little shop. And it may be a big shop in the case of Germany, or it may be a little compressed, oppressed shop like Greece. And we lose the potential. So that's about medicines. For eHealth deployment is about health. It's about health services in the end. And we need to understand. We need to understand what is healthcare specific. And I very much liked your presentation about AIDAS, because you actually said that. You said, this is the part that is the general. This is a part that is about electronic identification. And this is the part where you give the opportunity to eHealth to customize, to bring their needs in the picture. So this is about adaptation. But at the same time, what worries me is the fact that we are very much limited to the cross-border, and we miss the opportunity for innovation, for advancement. And yes, I will give another example about medicinal products and the discussion we had recently about online pharmacies. It's amazing what's going on. It's amazing what disruption we are facing. So I have the fortune and the humility and sometimes the hubris as well, I must say, to lead the eStandards project, which aims to look at the way eHealth standards should be in the future. We need to create a roadmap, and we are talking to people. I'm talking to people extensively because I have many questions and very few answers. You may have seen the picture on the wall in the presentation of that Zoe made. And you saw that there was procurement there. We missed the box here. But it's actually included where you see the live deployment. Because the way we see standards is in a cycle, in the cycle that goes from base standards and requirements to use cases, to education, to assurance and testing, to deployment, but also to monitoring the solutions, to change management, to feedback, so that we can be better. And I very much liked the idea of having the code for the rare disease in the patient summary, because that's one change that can take us another cycle, that can take us a cycle that will refine and will give value. We won't get it perfect, but it's this iterative development that brings value. It's that iterative development that creates more of Europe. Another question I have, and I've been pondering about, and it is displayed in the graph you see behind me, is the question of standards and profiles of things that are rooted in the hospital, of disruption that comes from medical apps that are outside the health system, and they claim our data. They claim our attention. They claim health service, in essence. When Fitbit, for instance, goes online and said, we are a health service, you have to think about it. So one of the things that have been one of the fallacies, I think, is the idea that standards is an afterthought. Traditionally, we have been thinking that you have a process, right, like an engineering or industrial process. You go through that process, you validate it, and then the process, when it is corrected and debugged, becomes a standard. And it doesn't change, right? So now we have standards that are something like infrastructure for innovation. We have the fire standard in HL7, which is about resources and profiles, like an 80-20 rule, that aims to create an infrastructure where data will be open and available, where you can use this data to create innovation. And then you need to lock this innovative approach to a more slower, more sustainable standardization, the traditional approach. And this is what, excuse me, you see in the graph behind me. You see systems of innovation that move really fast on the top, and then you see systems of differentiation, which is about claiming a piece of the market, and you see systems of record, which are slower, and it's about documentation. So this is our project. We very much look into the cycle, plan, do, check, act that is rooted in quality management, and we'll try to bring together the different pieces. We try to bring together global standards, socioeconomic aspects of interoperability, the eHealth interoperability framework that Zoe was kind to put up, and also the feedback from large-scale eHealth deployment. So in our project, we have put together a group of excellent, outstanding experts, and we asked them what are the gaps? What are the gaps that standards need to fill in? And perhaps there is a notion of convergence also there. The underlying theme was that we need to solve a problem. I also mentioned one problem, the part that goes fast with the part that goes slow, the part that talks about a standard that's created in 1 hour versus the part that takes a year or longer. The part that, that I would like to introduce here is the problem of patient-generated data, the problem of volume, of low quality, lots of data. How do we put them in the cycle? How do we improve the system using also data from the patient, giving feedback? And that is a huge disruption. This is actually the point that underlines our recommendation. How do we enable, for instance, just to take number 3 on the wall, the flow and mixed use of data, data that comes from different jurisdictions, different systems, and personal health devices? How do we bring them together and make sense at 2 levels, at the level of the individual and at the level of the community? I think this is a huge challenge. And of course, the other part that I think that also Carl mentioned, and I must say, because this is one of my favorite problems, is going back to the pharma and the regulatory framework. There is a regulatory framework that is there to support and protect the industry. However, there are also safety issues that relate to us as individuals. And this is in the leaflets, in the example of the Canadians. Could we make leaflets that are for me or for Zoe if she has a different profile, or for Carl, given his medical history? Can we unlock the power of our personal data so that the information that we get from the pharmacy is appropriate for each one of us? That's the power of information, that's the disruption, and that's where we have to set higher standards and higher expectations of technology. And it's there. We just need to open up our minds and embrace the digital. So perhaps I will try another one before I bore you to death, and that is about a governance process. If we want to get standards developing organizations to get together and maybe achieve a certain level of convergence, we need to have a clear governance. And I have a couple of examples to give. One of the examples that is quite powerful is the idea of IHDSDO, and Veli talked about SNOMED-CT and LOINC. LOINC is a terminology that rules in the lab space. SNOMED-CT is a terminology that has a very global view of the world. Members to SNOMED, members to IHDSDO are governments, and their aspiration of this SDO is that if you are a member of IHDSDO, you will deploy SNOMED in every single organization in the country. Maybe this is old-fashioned, I would say, because now we are talking about Europe, and we are trying to bring down the barriers between the member states. But even so, the idea of having terminology or having a common language that is spoken around the world is amazing. So these 2 organizations actually went into an agreement. And I must say that it is a very important negotiation agreement. For those of you that are interested in negotiation dynamics, reading that agreement would amaze you. Because there is a notion of where we give ground and where we kind of establish ourselves and how we work together in the gray space that I think has the essence of giving value to the people. And that's about convergence. That's about understanding that we both exist, that we want to do good, and we want to work together. So our ambition is to create a roadmap that underpins this kind of cooperation, assuming coexistence of standards. We would like SDOs to cooperate with the players, because there is also the element that we cannot afford standards to be very general and abstract. We have to do things that are deployable now. And actually, in a previous session I was speaking, I was asking for a health bot, and I wanted it for Christmas, and I didn't want to do anything about it, but I would like it to be personal, parentheses. Anyway, so guidelines for deployment, no hustle implementation of standards, trust that the applications do what they are supposed to do for you. And my last thing is that it is well known that the one who pays for healthcare is sometimes not the one who benefits. So the costs, Carl would say, for instance, from the economic point of view, that the cost of healthcare and the cost of developing standards are misaligned with the benefits, in the sense that other entities benefit, essentially the patients or the public good, versus who invests the cost. So what we did in this roadmap, or the approach we took in the standard, is that we wanted to unpack this situation. So we are thinking of a compass that would help us navigate this change, this disruption that is happening with the digital. And we took 3 groups, or 3 perspectives, or 3 viewpoints. And you may recognize yourself in looking from that lens or from another lens at different times in your life. So you can think of yourself as looking from the perspective of a procurer of health services, or of a manager in a health system that has to make choices about what is bought and what is not, how things are implemented, what organizational agreements you will put forward, what to trust and what not to trust. That's the health system viewpoint. And yes, it has a standards perspective there. You need standards to trust. And then there is the consumer, like me, where I'm asking, what services are there for this health problem, and what to choose, and what to trust, and how can I help myself, and how can I make choices about health systems or a doctor? That's what the digital can do. And then there is the workforce. And that's about training. This is about the new competencies that we need to develop in order to cope with this situation. And this morning I was fortunate to be in a session on a digital curricula, and I remember that Ed Hammond said we need a mosaic of competencies. We need a mosaic of competencies so that we can select, we can do a shopping list, and we can think creatively and say, you know, I need to learn this today. And with people living long, we need to make those educational choices. It's about our professional competencies, it's about our personal competencies, it's about staying active in the game. The last but not least viewpoint is that of the market. In the standards market, there has been a long tradition of integration. There is an integration market that brings things together. But we are moving towards a data-driven economy. And there, people, we will be losing money. They will be losing money because of standards that are widespread. And then they will try to find a new niche. And that niche will be in the data. That niche will be in the data-driven economy. So, as I said, just to close, this is our challenge. This is our view of how standard convergence will play out. These are the big questions. How do you leverage the slow and the fast? How do you break down barriers and create new opportunities? How you educate people, and how you invest in standards.